Your legs carry the weight of your life, every step, every climb, every goal. But what if they're silently getting weaker? Whether it's the stairs you avoid, the walks that tire you out, or the pain you pretend isn't there, your body is asking for help. It's not just about exercise, it starts with nutrition. These 7 vitamins aren't just nutrients, they're your legs' secret weapons for power, stability, and independence. Top 7 vitamins that play key roles in strengthening your legs, especially in terms of muscle function, bone density, and nerve health. Each vitamin has a different but complementary effect. Let's break them down. 1. Vitamin D key role, bone strength and muscle function. How it helps legs. Vitamin D helps the body absorb calcium, which is essential for maintaining strong bones. It also directly influences muscle strength and reduces the risk of falls and leg weakness. Deficiency symptoms, muscle weakness, leg pain, increased risk of fractures. Sources: sunlight, fatty fish, like salmon, fortified milk, egg yolks. Recommended intake: 600 to 800 EU per day, more if deficient under doctor's advice. 2. Vitamin B12 key role, nerve health and energy. Production: how it helps legs, supports proper nerve function and red blood cell formation. Deficiency can cause leg numbness, tingling, and weakness. Deficiency symptoms: fatigue, muscle weakness, especially in legs, balance issues. Sources: meat, dairy, eggs, fortified cereals. Recommended intake: 2.4 mcg day. 3. Vitamin C key role, collagen production and tissue repair, how it helps legs. Essential for the formation of collagen, which supports connective tissues in muscles and joints. Also helps reduce inflammation and oxidative stress in leg muscles. After workouts. Deficiency symptoms: weak connective tissues, bruising, slow recovery from muscle damage. Sources: citrus fruits, strawberries, bell peppers, broccoli. Recommended intake: 75 to 90 milligrams per day. 4. Vitamin E key role, antioxidant for muscle recovery, how it helps legs. Reduces oxidative stress and helps repair muscle tissue after physical activity. Important for endurance and muscle healing. Deficiency symptoms: muscle weakness, coordination issues. Sources: nuts, seeds, spinach, sunflower oil. Recommended intake: 15 milligrams per day. 5. Vitamin B1 thiamine key role, energy metabolism and muscle. Contraction: how it helps legs. Converts carbohydrates into energy to fuel your leg muscles. Deficiency can result in leg cramping, fatigue, or even neuropathy. Deficiency symptoms: leg fatigue, muscle pain, poor coordination. Sources: whole grains, pork, beans, peas. Recommended intake: 1.1 to 1.2 milligrams day. 6. Vitamin K2 key role, bone health and calcium regulation, how it helps legs. Directs calcium to bones and away from arteries. Strong bones are critical for leg strength and mobility. Deficiency symptoms: bone weakness, risk of fractures, poor circulation. Sources: fermented foods, natto, hard cheeses, liver, egg yolks. Recommended intake: 90 to 120 mcg day. 7. Vitamin B6, pyridoxine, key role, protein metabolism and nerve function. How it helps legs. Helps in the creation of neurotransmitters and muscle-building proteins. Also reduces nerve-related leg pain or tingling. Deficiency symptoms: leg cramps, tingling, irritability, fatigue. Sources: poultry, bananas, chickpeas, potatoes. Recommended intake: 1.3 to 1.7 milligrams day. Bonus tips for stronger legs: pair vitamins with protein-rich meals for better muscle repair. Hydrate properly. Water helps deliver nutrients to your muscles. Stay active. Vitamins support muscles best when they're being exercised. Supplement only if necessary. Get tested before using high-dose supplements. Vitamin D, cholecalciferol. Role in leg strength. Enhances calcium absorption in the gut, crucial for bone mineralization. Stimulates muscle protein synthesis, especially in fast-twitch fibers used in leg movements. Improves neuromuscular coordination, reducing falls and leg fatigue. Deficiency symptoms: weak or aching leg muscles. bone pain or frequent leg fractures, muscle cramps, especially in calves. Best sources: sunlight 152 OM a day on skin, fatty fish, salmon, mackerel, sardines, fortified dairy, egg yolks, mushrooms, especially UV exposed. Supplement tips: combine with vitamin K2 and magnesium for better bone, calcium metabolism. Daily dose 600 to 2000 IU, higher only under medical supervision. Vitamin B12, cobalamin, roll and leg strength, maintains myelin sheath around nerves vital for motor control of leg muscles. Helps form red blood cells which carry oxygen to working muscles. Supports energy production in mitochondria. Deficiency symptoms: numbness or tingling in legs or feet. Muscle weakness, especially in thighs or calves. Poor balance or coordination. Best sources: meat, beef, liver, poultry, fish, trout, tuna, eggs, dairy, milk, yogurt, fortified plant milks, cereals for vegetarians. Supplement tips: vegans often need B12 supplements or injections. Absorption may be impaired in people over 50 or with GI conditions. Daily dose 2.4 mcg, higher if deficient. Vitamin C, ascorbic acid, roll and leg strength, promotes collagen synthesis, vital for ligaments, tendons, and muscle fascia in the legs. Helps in iron absorption, key for energy in muscles. Acts as an antioxidant, reducing post-exercise. Leg soreness and inflammation, deficiency symptoms, weak connective tissue equals knee or ankle pain. Slow muscle recovery, fatigue in legs, easy bruising or bleeding in legs. Best sources: oranges, strawberries, kiwi bell peppers, broccoli, kale, guava. Brussels sprouts supplement tips: water-soluble. Excess is excreted, enhances iron absorption when taken together. Daily dose 75 to 90 milligrams, higher for athletes or during recovery. Vitamin E, tocopherol. Roll and leg strength, neutralizes free radicals created during leg workouts. Prevents oxidative damage to muscle membranes. Aids in faster muscle repair and recovery. Deficiency symptoms: muscle weakness, especially in legs. Balance issues or unsteady walking, ataxia. Delayed muscle healing after exercise. Best sources: almonds, sunflower seeds, hazelnuts, spinach, avocado, wheat germ oil, peanut butter, olive oil. Supplement tips: fat soluble. Take with a meal containing fat. Don't exceed 1,000 milligrams per day to avoid bleeding risk. Recommended intake: 15 milligrams per day. Vitamin B1, thiamine, roll and leg strength, converts carbs into ATP. The main energy source for leg muscles, important for nerve signaling, especially in calf and thigh muscles. Maintains electrolyte flow across muscle membranes. Deficiency symptoms: burning sensation or cramping in the legs, muscle fatigue, especially during walking or stairs. In severe cases, beriberi, numb, weak legs. Best sources: whole grains, brown rice, oatmeal, pork, legumes, peas, nuts, seeds. Enriched cereals. Supplement tips: needed more in high-carb diets or during intense training, often found in B-complex. Supplements. Recommended intake: 1.1 to 1.2 milligrams day. Vitamin K2, roll and leg strength, regulates calcium placement, puts it in bones, not arteries. Prevents calcification of blood vessels in the legs, works with vitamin D to improve leg bone strength. Deficiency symptoms: bone pain, fractures in legs or hips, poor leg circulation, cold feet, varicose veins, slow healing of leg bruises or cuts. Best sources: natto, fermented soybeans, hard cheeses, egg yolks, chicken liver, sauerkraut. Grass-fed dairy. Supplement tips: look for MK7 form, longer half-life. Often paired with vitamin D3. Recommended intake: 90 to 120 mcg day. Vitamin B6, pyridoxine, roll and leg strength, helps form neurotransmitters, serotonin. Dopamine, for muscle coordination, assists in protein metabolism for muscle repair. Supports nerve function to prevent numbness, tingling in legs. Deficiency symptoms: leg cramps or restless legs, tingling or pins and needles. In feet, legs, fatigue or stiffness after walking or climbing. Best sources: poultry, Salmon, tuna, bananas, potatoes, spinach, chickpeas, fortified cereal supplement tips. Can be part of a B complex. Long-term high doses, 100 milligrams day, can cause nerve issues. Recommended intake, 1.3 to 1.7 milligrams day. Vitamin Key benefit food sources. Signs of deficiency: D muscle plus bone, sunlight. Fish leg weakness, bone pain. B12 nerve health, meat, eggs, numb legs, poor balance, C tissue repair. Citrus, peppers, weak joints, slow healing or recovery. Nuts, seeds, muscle weakness. B1 energy grains, pork cramping. Fatigue. K2 bone plus circulation, fermented foods, poor healing, weak bones. B6 nerve plus muscle, bananas, chicken cramps, tingling.